open the forum. So we'll go to approve the minutes as read by mail. Is there any additions or corrections from the March 31 meeting? If not, they stand approved as read. And let's go to item 4, new business. Item A, review and approve the following policies.
Oh, sorry.
No, go ahead.
Number 1 is general safety. It's for our disaster, and then general maintenance safety, safety and risk management. So, Angela's been working really hard on these policies and, actually just updating them to, I think, we get in this thing where these haven't been looked at for a while. And so anyway, the last one under disaster was done in 22, or updated in 22, so it was really due for a good overview. And so Angela just kind of got it all up to date. There's really nothing specific for me to point out to you, but just all up to date as to kind of what we do now, and more modernized as to what kind of, what we're doing with this. And then we also did the general maintenance safety, same thing there. There was just some old like wording and stuff that we don't really do anymore. And so she just kind of took that out and updated all of that. And then on number 3, it's a sexual assault survivor for nursing policy. We've visited this policy several times before the new year hit, and then decided after January, when we looked at it again, there's a lot of new laws and things like that have came into place. And so the last time we revised this was in November of 25, but after we kind of all had a reset after the holidays and things, we came back to it and decided that we probably needed to revise it again. And so that's been revised. We've changed and updated it to, we really want to encourage all these patients that come in that are sexually assaulted. We want to encourage them to go to the proper facility to be taken care of, and that's a safe, ready facility. It's called, these nurses are specially certified, called SANE nurses, but you can't force someone to go. And so the new law states that if they refuse to go, that you have to provide your best effort to forensic exam for these patients. And so we've updated our policy to fit the needs of that as best we can. So that's the changes that we made in this one. We've ordered the forensic kits. They're just very basic and minor because, that's all that we've ordered the kits that we had to have for this and all that. So hopefully we don't ever have to use them because we don't want to, but we want to be able to provide the best care to these patients, and that's really getting them to where they need to go. So that's it for those. We just need a motion for.
Yeah, we just
1,
need
2,
to
and
entertain a
3.
motion to approve.
I'll make a motion for 1, 2, and 3.
Have a motion and second on item 4, 1, 2, and 3 under A. All those in favor say aye.
Aye.
Opposed? Unanimous? Motion passes. Now on to item B and all of the appointments to medical staff.
So the first one is Calvin Arbor, and he's a PA that comes and works for us in the ER some. But the rest of them, we went and transitioned to a new radiology reading company for our x-rays, CAT scans, and all that kind of stuff on last week on April 21st. And so this is all of their readers, their radiologists that'll read our studies for us now. So, California, kind of, all over the place. But we were doing Vesta Radiology. That's who was reading our reads, and this is called Inspire. So, so far it's been so good. It's been good. So 1 comes regularly, and then 2 through 19 are going to be just approval for radiology reads, but you can approve them all together.
Make a motion to approve the following appointments to medical staff under B 1/19.
I second.
I have a motion and a second to approve items 1 through 19 under B. All those in favor say aye.
Aye.
Opposed? Unanimous? Motion passes. We're down to financial health thing, checks, transfers, bank balances.
We've got checks for the month of February there. We wrote checks totaling $216,000 in February. Nothing super notable for me to call out. Our ACH has totaled $151,000 for the month. Did y'all see anything weird or anything you got questions on? Okay, we'll look at our bank balances as of last Friday. We had about $4.75 million in cash. The majority of that's in our tax account, and we've been busy with swing vets, stayed busy with swing vets, and so that's been helpful for cash flow, and really had to operate much out of our tax account, which is always great. Anything on that?
Is the self-funded insurance, is it growing each month?
It is growing. So we the first year from March through December of 25, our Blue Cross bill was roughly $60,000 or so a month, and so we contributed that. Now we have enough back claims data that we can that the insurance company did this actuarial analysis of what they think it would reasonably cost to fund the plan, and so we accrue that and can accurately project that and hopefully put that on the right path. So it's in its own separate account. That cash isn't necessarily restricted for that use. It's just included in general cash on financial statements, but we do have a liability accrued for the actuarial amount determined.
Kind of was like a security blanket to make us feel a little bit more at ease when we did transition to self-funded, so that we weren't just pulling money out of general. We could really take a good look at it.
The vast majority of our subscribers or members are using us for our own services and for their services, and so that obviously doesn't cost us anything directly. And so like our monthly or weekly check runs out to other providers are very small usually, unless we've got like a big surgery or something.
Yeah, we've had a few big claims, but.
Okay, we'll look at stats, tax collections, and financial reports. Financial statements for February. The hospital had a $935,000 gain for the month and a nearly $1.7 million gain for the year, and just temper that with that $1.1 million of tax revenue collected and thereabouts $800,000 in other revenue in the second from the bottom line on the top section, which is wind farm revenue. And so we take that out and we're still thereabouts roughly on track with the budget, and so I'm happy with that. We just have to view that in perspective with for these first couple of months at least, with those big tax revenue and wind farm increases. Salaries are kind of something that are always a hard and interesting way or thing to budget for, and so we never know what things are going to look like and how overtime is going to work and how staffing is going to be for nursing or whatever department. And so we're pretty close to about $10,000, 1.5% variance there, which is good. We're not terribly off, so I'm happy with that. Have any questions on those line items? Okay, and we'll look at the clinic for the same month. Oh, your balance sheet is in here, and I just wanted to mention the patient accounts receivable. And so this month, the accounts receivable was about 2.2 million. At the end of the year was 1.7 million. And so we're used, if we look at 2019, 2020 numbers, our AR was 900,000 to 1.1 million. And it's nearly doubled. But we watch this days and AR number, which tracks how effectively we're collecting money on accounts, and we're constantly decreasing that number and improving that number. And so we look at this bigger AR number because we have our volume has increased and services have increased, and so I'm not concerned about this AR growing, or we obviously watch it, but we also can look at our days in AR number and see that that's improving and not getting worse, and know that we're not in a bad place on that AR. So I'm happy with that.
Do they send those current breakdowns of if they're like current 60 and 90 days out on our True Bridge thing?
They don't, but we have a
Easily identify? But
our days in AR are roughly 65 or so. So it's taking us 65 days from the time we discharge to the day that we reduce the account to 0, which I'm happy with. We were routinely in the 110s, 120s 5 or 6 years ago, and so that's a big improvement, collecting on cash nearly double as fast.
what's our target goal we want to be at?
We'd love to be, I think 60 is a good target goal. I'd love to be 50. If we break that down by the clinic is probably closer in the 30 days, and the hospital is probably closer in the 75 days. But the clinic accounts are easier because they're collecting a copay at time of service, and so all they're waiting for is the insurance company to pay, and that account is 0 if we've collected the copay accurately. Where in the hospital, a lot of times we're billing the patient or sending a statement for a couple of months.
They're a lot more complicated.
We'll look at the clinic. Still behind budget, about 78,000 behind budget through February, and so we've had a lot of conversations about that, and have some ideas, have implemented some ideas, done some training on E&M coding and how to make sure that we're maximizing any spot that there is for revenue. Contrastly, salaries are down under budget, and so that's helping us stay on this target for where we're not terribly off of budget on our net income gain or loss for the year. So that puts the net income loss for the year at about 6,200. Do you have any questions on any of those? And the clinic AR is here on your balance sheet page. Their AR is about 133,000, so decrease since the end of the year at 12/31/25, but about 160,000. Any questions on any of those line items? Okay, our tax collections through February, the appraisal district had collected 92.32% of our roll, which is great. So we're roughly mostly or all collected. I think our historical average has been in the 95% range, and so it's probably where we'll sit through October or September. Leanne, you want to do stats?
Sure.
Let me rotate. Okay.
On this one, I noticed that for February, in comparison to January, our treatment rooms were down quite a bit, but I think January was a little skewed because we had recurring patients that were coming routinely, daily, or multiple times a day for different things. Sometimes it's wound care, sometimes it's antibiotic, and then once that course is completed, then they no longer have to come. So I don't want to say skewed because I'm just saying a heavier volume as far as their frequency for January. Other than that, everything pretty much looked on track to me. I didn't see anything that was crazy off. We'll move to the next one. We had a total of 4 Medicare admits and 2 for January and 2 for February that were traditional Medicare. We did not have any Medicare Advantage for January or February. Skip over that next page, we'll go to the swing beds. We had a total of 9 for January, 5 were traditional, 4 were Advantage, and then 6 for February, 2 were traditional and 4 were Medicare Advantage. we watched those numbers really close. On OBS, we had a total of 7 for January. And then I think we already went over those last month. And then February, we had a total of 5. 2 were Medicare, traditional, and 3 were Advantage. So just keeping an eye on those numbers and making sure we're still in line with where we need to be. We had 2 deaths in February, but they were expected in swing beds, so, or not expected, but we knew they were coming a little bit. Those were swing beds, so.
And we'll look at our bad debt for March. We had 58 accounts on the hospital side for about $34,000. 7 accounts on the clinic side for $425. Any questions on any of those items? Okay,
My turn?
your turn.
Okay. So, I was just gonna, let's see. So we have Hospital Week coming up in May. We'll send out info to you guys if y'all wanna join us on any of those days. They're already working in the planning stages of what will be every day. I told y'all earlier, but we successfully transitioned to a new radiology company, last week, Inspire versus Vesta. Caleb did a lot of work with that, transition as far as just kind of coordinating the IT stuff and some of the credentialing stuff, and so, he did really good, to help us out with that. We did get a new payroll, HR person in that position for Teresa, where Teresa Terry worked. Today is starting the 2nd payroll, and so that's going really well. She's doing great. She was a previous employee that we moved from the business office, to that role, and she's gonna be great. Caleb's working with her side by side on the payroll aspect of it and things that they need to do, and then she's asking lots of good questions. So I think it was a great choice. We're doing some community outreach, working at coordinating with the economic development of Rotan. They're having a centennial celebration during July the 4th, something like that. Yeah, it's on July 3rd and 4th. And so the hospital's gonna sponsor the 5K fun run or walk, whichever one you want. Anyway, we're doing t-shirts, pre-registrations. Economic development is gonna provide prizes for that. But the hospital's gonna sponsor, coordinate, keep it all together, and then also purchase the t-shirts for that. So they asked lots of local businesses to come to some meetings and things like that, and then other community members were there too. We're just in the planning stages, and so anyway, we jumped on that one because it had the most to do with health, and so anyway, that's what we're doing. There's lots of big grants going on right now, lots of big money, state and federal level. We're just watching them all really close. They're all really named exactly very similar, so they're very hard to keep up with, and it's just overwhelming a little bit. But one of them I know for sure, the big grant, we're probably gonna have either someone that we can identify that doesn't have that much to do, that can spend the majority of their time on this grant, or hire someone there, because one of the rules to the grant is they have to spend 85% of their time on just that grant alone. And so I know Caleb and I worked together to already do the rule stabilization, and so that's already done and submitted, so we're good there. I was on a call on Friday for it's called it's $60 million total. It's dispersed out into 80 hospital districts, so we would qualify. In Texas, it's a non-compete grant, and then there's different years that you have to meet different metrics, but in year 1, if we're pretty positive that we would get the grant. It's $750,000 just for year 1, so
And this is phase one of the Rural Healthy Texas Strong, which is the trickle down of the OBB money. So this is just
Kinda like
phase
the
one.
old district is, a lot of the measures are mimicking like what the old district did, so. It's kinda like.
What do you use it towards?
There are specific things you have to use it for, but, I mean, they are very, the metrics to qualify and report are very broad and vague, so that you can utilize it the way you need to, and you're not stuck with. But, I mean, it goes like, one of them's for, like, improving some kind of clinical, like, it would be like, just say diabetes. And then the year two is for funding for, like relocation and, reimbursement, trying to get like medical professionals back to your area, recruitment, retention, things like that. Then year three is like, it has some other metric, so lots of different things there. And then there's also another one, but I haven't had any, that's a big one. But I haven't got all the stuff on it yet, but, that's the one that's gonna make, you have a person designated to go do that grant, so. Anyway, we definitely wanna, if we implement new metrics for like wellness, education, community, things like that, we want it to be something that we can sustain it through after funding, cause we don't wanna create a program that's real grand and great for our community or for our patients that really need it, and then just have to pull the program whenever there's no more funding available, you know, because that never helps people. So we need to be very smart in the way we implement this and the way we think through what we want to do with this. So on the clinical aspect and on the financial aspect, and just as an organization as a whole, something that's going to be very beneficial and use our money wisely. So capital improvement grant, I got that closed out last week. Anyway, we've submitted that all for the PT project. Even though the PT project is not 100% complete, I worked with them for us to go ahead and close it out and get that reimbursement back, and it's almost 100,000. It's 90 something, so it's really close to 100,000 that we'll get back on that for the PT renovation. And then we've submitted reimbursement for the BIP grant, which is the broadband improvement, the technology grant. I submitted 14,800 for January, and then we've got about 50,000 new stuff to submit. So anyway, we're all working together on that. Thank goodness, Caleb and Michael, our IT guy, they know IT and computers, and I'll just do the submitting and the reporting. And they can keep me straight on all the other stuff. So anyway, it's gonna be a good resource for us to have, that BIP grant too, once we can get all those computers deployed out to our people that need them. So, I don't think we do have a spot open on our deaf court board. That's not an appointed, that's just, like, we can just appoint someone. Since it's a 501c3, it's kind of a closed type thing. We do not have like voting or anything like that on that board. So Robert Posey moved, and so he stepped down. So we're working on that. We did not have a meeting for Deaf Corp on January, and then we didn't have a quorum this last week. And so we did reassure them that our legal obligations are only for once a year, but we can also change our, what is it?
Bylaws.
Yeah, our
allow-
bylaws to reflect what we need it to look like. So they only meet once a quarter anyway. And then Caleb and I are we're gonna gather some more information, but at one time, I know the way that was set up was beneficial, most beneficial for the district and for the corporation. And it had a lot of grant money tied to it and things like that. And nothing really goes through there anymore, as far as that goes. So we're talking about maybe making some changes there, but of course, we would not make any changes without, we've already talked to BKD or Orbis or whatever you wanna call them now. But, anyway, without 100% being sure that that's the direction we wanna do to, join them, so. More to come on that later, don't get worried about that, because we haven't done enough research or our homework, it's just been like initial talk, so I just kinda wanted to throw it out there, that it might be coming. If y'all think we're crazy, probably are. Not really. You have anything to add to that, or what?
Nope, our auditors will be, next meeting will be a big meeting. We've got an abatement item on the agenda, a previously considered abatement. Or we've approved an abatement for the solar farm. They requested an amendment, I guess, to what their scope of the project is, and so it's,
Out here by Newman.
no, up by
it's smaller.
Escoda, way
Oh.
up far in the.
I sent y'all an email on it.
So we've posted the 30-day requirement to reconsider an abatement item, and that'll be in May, and we're not sure if somebody from the company will be coming
Yeah, we don't
to
know.
explain. But, and then our BKD or Forvis will be here to do audit presentation, and we'll have a final cost report by that time. So. And it's gonna be on Tuesday instead of Monday, because Monday is Memorial Day.
Any questions for us? Okay.
How big is the solar farm gonna be, you know?
Tell you what their original proposal said.
I'm just curious.
Well, I'll read you,
In that
Is it
email.
Escota?
it's out by Escoda. I'll read you what our 30-day posting says. How about that?
Okay.
So they originally the original cost of the improvements was 210 million, and now they're proposing to reduce the cost of improvements to approximately 170 million.
Mm-hmm.
40,000,
They come
40
down.
million.
40 million, yeah. Huh? Yeah. Right on?
Yeah. Bed.
Thank you, Kevin.
You're welcome.
Okay. I guess we're down to progress reports, or have we done everything we're gonna do there?
Yep, we're down to closed.
That's what I saw. He thought he might have been left. All right. At 1:04, Fisher County Hospital District will go into closed session under state health and safety code 161, 003.
And Texas Government Code 551-074.
Yeah, and that next one, that's on the other page.
Yes.